So are we testing diabetes wrongly? We're asking this because a study which points out that the accuracy of some diabetes testing methods when used in isolation may not be correct. The study points out that diabetes diagnosis in India may be misled by the HbA1c tests. Published by the Lancet Regional Health Southeast Asia, the study says that the reliance on this test alone could delay diagnosis by up to 4 years in some men with G6PD deficiency. Now, G6PD is a hereditary genetic disorder that affects the red blood cells, potentially increasing risk of complications. And the study further questions the reliance on HbA1c as a sole monitoring tool for type 2 diabetes in South Asia, especially India. And it says that in many cases, this should be combined with other tests for the diagnosis and monitoring of diabetes. Researchers have recommended combining HbA1c test with other tests like oral glucose tolerance test and regular blood sugar monitoring. Now, flagging the rising number of people with type 2 diabetes in India, the study says that it is thus essential to maintain good glycemic control to prevent a substantial burden of diabetes-related complications. It was also imperative that type 2 diabetes is properly diagnosed and is monitored to reduce this burden and to avoid any kind of adverse outcomes. The further accurate diagnosis is required for prediabetes and diabetes for appropriate management. The study says that India needs a more comprehensive approach to accurately diagnose and to monitor the type 2 diabetes. The HbA1c test measures average blood sugar levels over the past 2 to 3 months by checking the percentage of hemoglobin that is coated with glucose. But experts say that the test picks up people with very mild abnormalities and labels them as having diabetes.
It is the gold standard for assessing long-term control of diabetes. However, it is not the gold standard for diagnosis of diabetes. That is what is meant. I published an original report based on thousands of patients who, not from the clinic, from the epidemiological studies, and this was published in their own journal, in Diabetes Care, criticizing it, and I said glucose still remains as the best test for diagnosis. Either a fasting glucose or an oral glucose tolerance test, 2-hour value, should remain the gold standard.